Welcome to Only for Seniors. I'm Dr. Eric John, and it's a privilege to be here with you today. I know firsthand how complicated, overwhelming, and at times even frightening the U.S. healthcare system can feel, especially as we grow older. Between the rising costs, confusing insurance paperwork, long waits, and sometimes not even knowing where to begin, many seniors over 60 feel like they are left on their own to figure things out. But I want you to know something very important: you are not alone. Today's video is about something that affects every single one of us after 60, navigating the U.S. healthcare system. I'll walk you through the practical steps, age-friendly advice, and insider knowledge that will help you not only access the care you need, but also protect your rights as a senior. By the end of this video, you'll know exactly how to choose the right doctor for your needs, how to get the most out of Medicare and supplemental insurance, how to protect yourself from medical billing traps, how to use patient rights and advocacy to your advantage, and how to build a healthcare plan that works for you, not against you. So let's dive right in. Chapter 1: The Reality Seniors Face in the U.S. Healthcare System. If you're over 60, you already know this truth: healthcare in America is expensive, complicated, and too often unfair to seniors. Many of you have worked your whole lives, paid into Medicare, and now, when you need help the most, you face hurdles that make care harder to access. You may feel frustrated by doctors rushing appointments, confused by complicated Medicare Advantage or Part D drug plans, shocked by medical bills that don't seem to make sense, or even discouraged because you feel your concerns are brushed aside as just part of getting older. But here's the good news: you have more control than you think. Seniors have rights, options, and tools that can make this system work for them. It's about knowing how to play the system smartly, and today, I'll guide you step by step. Chapter 2: Choosing the Right Doctor After 60. The very first step to better healthcare is having a doctor you trust. For seniors, this is usually a primary care physician or PCP. But here's what most people don't realize: the doctor you choose can make or break your experience in the healthcare system. A good doctor will listen, advocate, and help you navigate referrals and insurance. A bad doctor will rush you, ignore your concerns, and leave you lost in paperwork. Here's what to look for. Experience with seniors. Ask if they have geriatric training or if they regularly treat patients over 60. Willingness to listen. A doctor should allow you time to ask questions without rushing. Care coordination. Your PCP should help you manage referrals to specialists. Accessibility. Does the office offer same-day appointments or telehealth visits? Practical advice. Before your first appointment, call the office and ask, how much time does the doctor spend with each patient? If it's less than 15 minutes, consider looking elsewhere. Chapter 3: Understanding Medicare Basics. Medicare is both a blessing and a maze. Let's break it down simply. Medicare Part A covers hospital stays. Part B covers doctor visits and outpatient care. Part D covers prescription drugs. Medicare Advantage, Part C, combines everything into one plan, but with networks and restrictions. Here's my advice. If you see many doctors or travel often, traditional Medicare with a Medigap plan may give you the most freedom. If you're healthy and like one network, Medicare Advantage may save money, but watch for limits on doctors and hospitals. A hidden trap? Prescription drug coverage. Every year, drug formularies change. That means the medication covered this year may not be covered next year. Seniors should review their plan every fall during open enrollment, or risk paying hundreds more. Chapter 4: Dealing with Medical Bills and Insurance. Now let's talk about something that makes many seniors lose sleep: medical bills. Did you know? Over 60% of seniors in the U.S. worry about medical debt, even with Medicare. Here's what to do. 1. Never pay a bill right away. First, request an itemized bill. 2. Check for errors. Up to 80% of bills contain mistakes, like being charged twice or for services never received. 3. Ask about financial assistance. Even Medicare-approved hospitals must have charity care policies. 4. Negotiate. Yes, you can negotiate your bill. Call and say, "I'm a senior on Medicare. Is there a senior discount or payment plan available?" One of my patients once saved $1,200 on a hospital bill simply by asking for a Medicare financial counselor at the billing department. Chapter 5. Knowing your rights as a senior patient. Seniors have rights under federal law, but many don't know them. Here are a few. The right to an interpreter if you struggle with hearing or English. The right to appeal a Medicare decision if coverage is denied. The right to refuse treatment if you don't feel it's in your best interest. The right to see your medical records at any time. Practical tip: if you ever feel dismissed by a doctor, say this: "Can you please note in my chart that I requested further evaluation, and it was declined?" This holds providers accountable and often makes them reconsider. Chapter 6. Specialists, Hospitals and Care Coordination. As we age, we often need more specialists, cardiologists, endocrinologists, orthopedic doctors, and more. But care can become fragmented. Here's how to protect yourself. Always carry an updated medication list. Use one pharmacy to avoid dangerous drug interactions. Ask your PCP to act as the quarterback of your care. Bring a friend or family member to appointments for support. Remember, you are not a burden. Having an advocate with you improves care. Chapter 7. Mental Health and Emotional Support. Healthcare isn't just about the body, it's about the mind. Sadly, many seniors avoid talking about depression, loneliness, or memory changes because they fear being dismissed. If you feel down, anxious, or forgetful, you are not weak, you are human. Medicare covers mental health services, including counseling and psychiatric care. There are also senior support groups and free helplines available. One of the bravest things you can do is say, "I need help." Chapter 8. Making the system work for you. Let's pull this all together into a practical plan. 1. Choose the right doctor, someone who respects seniors. 2. Review your Medicare plan annually, especially Part D. 3. Always check your bills for errors, and negotiate if needed. 4. Know your rights, and use them. 5. Bring an advocate to appointments, don't go it alone. 6. Take care of your mental health, because a strong mind is just as important as a strong body. Closing message. The U.S. healthcare system may be complicated, but with the right tools, knowledge, and confidence, you can take control of your health journey after 60. Remember this: you worked hard your whole life. You paid into this system. You deserve care that is safe, fair, and respectful. Don't let confusion or fear hold you back. You have rights, you have choices, and you have a voice. I'm Dr. Eric John, and this is only for seniors. Thank you for joining me today. If you found this helpful, please share it with another senior who may be struggling with the healthcare system. Together, we can make sure every senior gets the care and dignity they deserve. Stay strong, stay informed, and I'll see you in the next video.